Hi. In this series on prognosis, we will try to understand the scope of treatment of rheumatoid arthritis using homeopathy. Rheumatoid arthritis is a chronic inflammatory disease of the joints. It is quite a difficult condition. It is an autoimmune disease which affects almost 1% of the world population, and it is very difficult to treat. In fact, many times the treatment itself or the medication given for it itself produces a lot of adverse effects, and the long-term management is really challenging. My name is Dr. Rajesh Shah. I am a homeopath and I am a director of Life Force Homeopathy, where we treat patients of various chronic diseases including rheumatoid arthritis from all over the world for last 3.5 decades. When I was going through the details, we found we have a record of around 300 plus documented cases of rheumatoid arthritis, and I'll try to give some brief prognostic notes on the scope of treatment of rheumatoid arthritis. Well, this being a chronic progressive autoimmune disease, which is a connective tissue disorder in a way, and it tends to affect various joints, small joints as well as large joints, and producing not only inflammation but inflammation, swelling, and eventually deformities in many cases, if not all. The treatment with homeopathy is good, I would say, especially in the early cases. The results are quite promising. The cases which approach us in the early stage of development of the disease, initially say 2 to 4 years, without having much of the drug dependency on conventional medicines, they are likely to respond very well to homeopathy. The cases which are taking certain immunosuppressive medicines such as corticosteroids, for example, and for a long time, then that makes it additionally challenging. The patients who consume or who have consumed methotrexate, another strong, powerful immunosuppressant, that also for a long time, that poses a really difficult situation for homeopathy to work. In fact, we have observed that cases who are taking methotrexate for say more than 2 to 5 years, and then we are not able to really help this patient because this patient, they develop kind of a drug dependency on methotrexate. So the results with homeopathy are very good in the early stages. It can help you to control the disease. It can help you get significant relief in the symptoms of pain, swelling, and controlling the deformity formation. Patients who approach us with deformities of the hands and legs, other joints, that of course cannot be reversed with homeopathy. It can only give palliative relief in terms of improvement in the pain and the swelling to some extent. However, deformity cannot be reversed, but that should be kept in mind. However, very important is that the disease process underlying, which is leading to the formation of deformities, that to a good extent could be controlled using homeopathy. That's what we can say from our clinical experience. Patients who have been consuming methotrexate for a long time, they should rather not try homeopathy except for some palliative relief, because these medicines are very strong, and then we are in a very difficult situation because we can't reduce the dose of methotrexate, and the moment we reduce the dose of methotrexate, there's a flare-up, and that flare-up is more difficult to treat than the regular presentation of rheumatoid arthritis. So the scope of homeopathy for rheumatoid arthritis is more of in the early stages, very good. In the later stages, it can control the disease progress, and in the very late stage with deformities, it can give only some palliative relief, or it cannot give really great results. So this is about the scope of treatment. Is homeopathy recommended for rheumatoid arthritis? Yes, of course. Homeopathy is very strongly recommended, especially in the early stages. In initial 6 months to 2 to 5 years, homeopathy is very strongly recommended for all the cases of rheumatoid arthritis, looking at the long-term management of this disease. How much time does it take to treat rheumatoid arthritis? Well, we cannot determine the time now, but it is a chronic and long-standing problem. So one has to take medication for a very long time, which may be 1 year to 2 years or even longer, depending on the extent and the chronicity of the problem in the given case. I hope this video, based on our experience at Life Force for the treatment of rheumatoid arthritis, will help the lay people, general public, as well as the medical students and other practitioners. Thank you so much.